HealingYourself.Life provides information for awareness, educational, and support purposes only and does not diagnose or prescribe treatment for any medical condition. Viewers are encouraged to do their own due diligence and consult with their own medical caregivers before making personal treatment decisions. Welcome back to HealingYourself.Life. We are once again with our family doctor and former FDA researcher, Dr. J. Nielsen, MD, who has a private practice in Northwest Ohio and a survival compound in the country of Haiti, where he serves dozens and potentially hundreds of families with Christian mission outreach and preparedness, survival, and self-sufficiency skills. He's here with us to talk today about the topic of attention deficit disorder, or ADD, which has been on the, at least recognized, on a great increase in recent decades in the U.S. and of great concern to many parents, children, and adults. Dr. Nielsen, thank you once again for joining us on HealingYourself.Life.
I'm glad to be here. I'm looking forward to this one.
I have a particularly personal interest in this topic because my son basically self-diagnosed himself with this after struggling through most grades of school with high conceptual potential and very low achievement and performance, and we wondered what it was. Was it phonics? Was it reading? Was it whatever? And we finally, this was one of the things that was really affecting him. And with proper treatment and with proper accommodations, he got up to his ACT score got up to 35 out of 36 possible total on a perfect score, and he's gotten straight A's in college since then, so graduates this summer. So anyway,
that's a common story for girls, not boys. It's very common for girls not to realize they have ADD until they go to college, because they make really good grinds and they just over persevere and they hang in there, and of course they're not being diagnosed because we expect boys to have ADD, so they get missed, and they just struggle and have anxiety and push themselves, and then when they get to college, the amount of material jumps up tenfold and they crash and they can't function. And they will commonly come in, and all I really have to do is help them deal with exams because they've learned everything else and they've really self-adapted. It's kind of fun.
So that was my personal side of this, and we could go into more of that perhaps later. But
well, we have to do a disclaimer on me.
Go ahead.
Okay. Well, first of all, we're finally talking about something I've got, right? I am big time ADHD. Okay. And anybody who watches me would guess that. And I do a lot of counseling of mothers with their children, and they come to me a lot because they know that. Okay, and that reassures them that they're going to get understanding, and they do for me. And that's going to take, I really want to go back later when we get to treatment, and I need to talk about my mother, because my mother was my treatment. We didn't know what ADD was back then. I had ADD in 1956, 57, hadn't been described yet. I was just the trouble kid in the class who couldn't stay in his seat. And my mother was my advocate. And I talk a lot to the kids about, don't turn on your mother. She's what you've got. You've got to work with her. She's the person who has the power to fix things when you break them. And kids learn that. They figure that out, that their mom is the one person who desperately believes in them. And I'm a great example of that, and I want to talk about it later.
I'll try to remind us if we get off.
Oh, I have a paper.
Very good.
I want to give people some reading today, because there's some good books out there. Okay. Helping Your Child by John Taylor, Helping Your ADD Child. Excellent book. Driven to Distraction by Hallowell. Okay, these books don't completely agree with my philosophy, but they're close enough to be worth reading. A wonderful book. I know this lady. I've done some research with her, Doris Rapp, MD, a pediatrician. She's the person who actually illustrated to the world that carpet backing was making everybody sick. Okay, and what she recognized from research is that kids in old schools had less ADD than kids in new schools because they were on vinyl or linoleum. Okay, and carpet backing is awful. The reason is lots of research is from the EPA about VOCs and all of the things that are coming out of carpet backing that are neurotoxic. And so when we get into causation and treatment, we're going to cover that in detail. Interesting, this was today in the news. CNN reported that street lights need to be changed in color from the blue color because it's causing cancer and neurological disorders from street lights. And that's going to make me go to my favorite topic, EMF, cell phones, cell towers, routers, range extenders, etc. They're terrible for ADD kids. Okay, so I have all of my families do an experiment once they've decided their child has ADD. We haven't defined ADD, okay? We need to spend a little bit of time just talking about what's the incidence of this. You already pointed out rising. If you go back to 2000, they quote 5%. If you go back 5 years, they quote 12, okay? And so I could argue from that EMF is certainly one of the things, but I could argue a lot of these toxins.
Chemicals, right.
Chemicals that we're going to talk about. And food allergies, another big issue.
Yep. Or what passes as food.
The thing to remember is that this is the mildest form of all the spectrum disorders, as we call them. On the other end of the spectrum is autism. Then we step back to Asperger's, okay? And then we have all of those neurosensory integration disorders that would include things like dyslexia. And finally, we get back to varying degrees of hyperactivity, okay? The important thing to remember is that the schools have major reasons to diagnose ADD and encourage it in their schools. First of all, we have the issue that the kids who are ADD are disruptive.
Sure.
And so, as a result, they need control. Teachers need control. Readily recognized. I was a nightmare to my teachers. And they liked me, but they wished I was in the other teacher's class, I think was how that worked out, usually. And they usually picked which teacher they put me with. They never gave me to old ladies. They always gave me to young people. They seemed to be more tolerant. And the second thing is there's now an economic incentive for the schools because they have these EIP programs where the schools get money and mom gets help at home and Medicaid steps in even though you're not destitute. There's a lot of money involved in kids who have any learning disability. There are teachers in the school that their payroll is all coming from federal grants to assist children who are disabled, etc. All of that is affecting it. When my kids were playing t-ball that age, my son was on a baseball group with 13 boys and 9 of them were on Ritalin. Oh, come on. There's no way that 9 out of 13 kids in his class had ADD. That school obviously really wanted to have kids on, Ritalin. And so I'm always pushing my parents to go, look, once you put kids on the stimulants, none of the nutritional therapies will work as well. The naive brain really responds well to detoxification and natural biological therapies. But once it's seen Ritalin or amphetamine sulfate, those drugs don't work anymore. And I have proven that over the years because I have great success with my mild therapies, but I don't on the kids who come in on Ritalin. So we need to really define ADD, and we know what it is. I'm not going to get complicated, but as I always tell the children when I meet them, I said, you and I are okay. We're moving along here at a fast clip, and your mom isn't keeping up with us, okay? I know that from my perspective and your perspective, we're okay, and they're slow, and that's their problem. The problem is, that doesn't work. You were telling the story about work and the guy at ADD who messed up a meeting. You've got to learn to be in your world. And so they're not going to get smarter and they're not going to get faster. So you're going to have to slow down, learn to pay attention, and drop the something shiny stuff as much as you can. But I don't want that to be confused with labeling anybody as defective. 70% of neurosurgeons are ADD. If you look through the very, very brightest people that you see out in your society, watch, they'll be ADD. You were talking about your son and his ACT scores after he got figured out. Great stuff, okay? Very bright young man, has figured this out. Now where is he performing? At the top of his game. And so I never let the parents label these kids or let these kids label themselves negatively. I only let them label themselves, but positively. And that really, really helps. I have had kids come back to me 10 years later and tell me that they really used self-talk from the things that I'd taught them to keep themselves going when they got in trouble. You know, and we'll go back to how my mother taught that to me later. There are reasons why this is happening. We have a 5-to-1 ratio of boys to girls. And the reason that that's true is because there's a deficient genetic function of 6-delta desaturase, which is an enzyme in tissue that turns alpha-linoleic acid, Wesson oil, into gamma-linoleic acid, evening primrose oil. And because we don't make that GLA, GLA is what makes up the cell membranes of the neurons of our brain.
Okay.
And so ADD people are all born to be here, okay? They're developmentally have developed a different form of wiring, and then they become hyperactive as an adaptive response. In David Horrobin, the greatest researcher of essential fatty acids out of Scotland, I did some research for him back in the 90s. Brilliant man. Did a lot of the foundational research. You always see him cross-populated as a reference in all ADD research today. And he proved that putting evening primrose oil in infant formula all but eliminated ADD in Europe. And they tried to get it into America. And, no, we don't want to do that. Okay? You know, there's no money in it. We're back to the old, there's no money in it. AD's another money machine, especially for the schools. And so that whole concept that this is a genetically expressed problem is where we want to go. Another factor that's out here is to recognize that there's a cross-population between eczema and food allergies and gut leak. And that's all been very, very well documented that research showed twice as much eczema in ADD kids as control populations. And so you also now have a gut-mediated problem of what you eat. And of course we have lots of those. Oh my gosh, NutraSweet just makes me go crazy. It's just absolutely the opposite of, you know, being on Ritalin or Anti-Med. It just revs me up and makes me very, very angry and really facilitates my ADD. And even in the smallest amounts. And artificial sweeteners historically have been, you know, that's been true. And then we, of course, we have the famous pediatrician, I'm going to block on him, that wrote the book back in the 60s about get rid of artificial colors, free sugar.
Oh, sure.
Yeah.
Sorry.
And it'll come to me after we quit talking.
Sure,
okay, I should have printed it and I wouldn't have that problem. And my mother had already figured that out. Mm-hmm. She figured out that I couldn't have a Twinkie.
Right.
The combination of sugar and the yellow stuff that was in Twinkies, boy, that'd send me out of control for a couple days in school. Yep. And so she had to figure out how to feed me and still give me my sugar binges, because all kids were on sugar binges, but not let me have colors or preservatives. So she did a lot of home cooking, and that worked. I tolerated sugar a lot better than colored sugar.
Yes.
You know, which made breakfast cereals very dangerous.
No, right.
You know, my mother always was giving me adult breakfast cereals, grape nuts and things like that.
No Fruit Loops for you, huh?
No Fruit Loops, man. Okay. One of the things you want to keep in mind is that there's really good testing now. I've never liked food allergy testing, but there's a new company out there called MRT, which is mediated release technique. And this test absolutely is the most accurate thing I've seen. And I've been doing it on all my ADD patients when I'm having problems with control and seeing eczema and allergies. And boy, you fix the food allergies and they look better. Little things are important. Research came out showing that low iron causes ADD to be worse. Seen it a few times, okay? This is the work from Horobin and all of those people going back and starting with the spectrum disorders and the role of essential fatty acids, omega-3s and omega-6, okay? And this has been done over and over again. The reason why we have the 5-to-1 rate is because testosterone pushes that 6-delta desaturase to turn on and stop the formation of the GLA, and estrogen turns it off. And so girls are being protected from ADD. Interestingly, I've seen more ADD in women with polycystic ovary syndrome because they have high testosterone.
I thought it was because girls are made of sugar and spice and everything nice.
And everything nice, yeah right. And but not food coloring, okay? Now, the next one you run into is mercury and all the heavy metals. And so and of course, this goes back to the vaccines and the autism, and we're not going to do autism today. And so I do hair analysis for heavy metal toxicity, and it's relatively easy to treat in kids because they don't have a mouthful of fillings and need $12,000 worth of dental work.
You use chelation, or what do you?
Sometimes, but a lot of times they're out there 10, 11 years old and they're using aluminum deodorant. And aluminum will always get in the way of the removal of mercury naturally.
Really?
So if you get them on biological probiotic, anti-odor, not antiperspirant products, okay, then, and let them go ahead and have wet armpits, they will unload their mercury on their own and do better. And you can prove that with hair analysis. And, you know, even the NIH has published, this is NIH study, showing that cadmium, arsenic, lead, mercury, aluminum, the biggest study that was ever done was an NIH study on all of the heavy metals, came out and said, yeah, there's a clear relationship, okay? This is the thing I was talking about with IEP and the fact that we've got these state programs that are sending funds into the school. When we get done, the thing that's important when you talk about treatment is that what my mother did for me is she recognized that I wasn't going to leave the house in the morning prepared. I wasn't going to get to school and get my materials from my locker into my classroom, and that I wasn't going to get my homework home. And so the first thing that my mother did every year is she always found out what teacher I was going to have the end of August. And in June, she took her to the country club for lunch.
Had a little talk.
And said, here's, you know, you're going to like Jay, okay? He's a good kid. I love him. He's wonderful. But you got to know how to handle him. You will not do a beat down on him. He is just absolutely Teflon when it comes to punishing him. You can beat him, he doesn't care. You can yell at him, he doesn't care. But he doesn't want to hurt your feelings. You want to engage him, you want to become his friend, and then you want to quietly, privately tell him that he disappointed you. He'll be devastated. And that's absolutely was true. That was just, you know, she had figured that out. And she said, you don't want to humiliate him in front of class.
Yeah.
What you want to do is you want to call me, because I'll be tougher on him than you will. But don't think that you can do this in class. It won't work, okay? And the teacher who pulled my hair and got fired would not listen to any of that. All the rest of the teachers, you know, really, really understood that. And I would come home sometimes thinking I'd had a pretty good day and come through the front door, and my mom would go, how'd your day go? And I'd go, good. And she'd go, no, it didn't. Do you want to sit? Let's go back, start through your day. How did it go? Tell me one class at a time. And it's usually after lunch, okay? Yeah, school was too long for me because I was bored. You know, in 5th grade, they let me go sit in the back and face the wrong direction, read a book. Okay. Because I could finish all my work in a third the time of the rest of the kids.
Sure.
Okay. And And when I think about it, I could narrow it down. She's, can you remember what went wrong? And usually I couldn't.
Yes.
Even trying. I mean, I was trying. And she'd say, and then she'd tell me, and I'd go, really? Yeah. Okay, I saw where that went south. Yeah, that made sense. What could you have done to prevent this? Okay. And she would walk me through it and try and get me to see a little earlier where the wheels came off. And it was usually that I thought I'd be funny. Okay. I think I'm funny. Okay. My biggest problem when I was a kid was I thought I was funny.
Well,
okay.
You were the day I came in with my ribs out, and I was trying not to laugh because it hurt.
And I was funny. Yeah. That's my problem. I tend to be funny at the wrong times. Okay. And exactly true. And so and the other thing she did was she was a list maker. Even when I was still in college, my mother still had the list on the back of the front door that said, do you have your gloves?
Yeah.
Do you have your hat? Do you have your homework? Do you have your book bag? Do you have athletics tonight? The number of times that I came home from school instead of going to track practice because I'm just on automatic and decided I wanted to go fishing. I didn't intend to skip it. I just, there's something shiny. Off we go, And she entrained me. I got to the point where seeing the piece of paper, I didn't need to read it. I knew that I had to go, yeah, I'm out of here. Okay? I still do that to this day. If you watch me as I head for the door of my house to go out through my garage, I do an assessment. My mother taught me that.
Mm-hmm.
Okay? And it's made me not make mistakes that I would have made if my mother had not trained me up. Okay. And I had the same thing on the door of my bedroom going into my bedroom. And while I walked in my bedroom, there was a, do you need to do your homework now? Okay, which it really wasn't good. I'm kind of revved up from getting out of school. Okay, can you wait an hour? Okay, is it safe to wait until after supper? Probably not. Okay, do you have music to practice? And kind of run down a list of things that I was supposed to do in my life, and my chores. And then my dad would, put a note right in the middle of it. You need to mow the grass tonight, etc. And I became very note-driven. And to this day, my wife will tell me to do something, and I'll go, write it down, put it out on the counter, and I'll do it. If she doesn't write it down, I won't do it. Something shiny, off I go. And that's ADD. You can try and define ADD. Now we have ADD and ADHD. It's clearly HD. Okay? Just legs bouncing and, etc. I don't think that matters much for anything we're going to talk about today. All that is really adding a movement disorder of being agitated. Okay? There are processing issues. I'm a little dyslexic. I was a brilliant mathematician and tested through high-level mathematics my first year in college because I'd had such good math training in high school. And yet, I had a college professor one day who said, have you ever noticed that every mistake you make on an exam involves the number 33? And once he told me that, I realized that the repetend, the repeat
Yes.
3, was not getting in my brain and I was dropping a 3. And once he told me that, I never did that again. But I had just a little bit of some kind of dyslexia. And so to see this as I can chop all these things up, no. There are things about me that are a little Asperger's. Okay, probably things about me that are a little autistic. But, it's a spectrum. And you can go pick up a symptom that's way out here on the spectrum, tics, okay, and meanwhile be functioning at a very high level,
Sure.
especially girls.
Okay.
And so there are lots of ways to diagnose ADD. My wife and I can both diagnose ADD in a 2-year-old. And we'll commonly, when I'm in the office, mom will be there and she didn't have a babysitter and she had to bring a child with her to the office. And he's over climbing on my fluoroscope and opening up my cabinets and, etc. And I go, what a great kid. I said, look at how well, he's busy, but he's really well behaved. He's listening to you, and it's amazing how much of our conversation he's following. 2.5, 3 years old, okay? And she says, oh yeah, he's my brightest child. I said, are you ready? I said, because he's going to be ADD. And 3 years later, she'll be back in my office going, oh, the school wants him tested, and et cetera. And I go, yeah, sure they do. Well, let's get to work. And, they don't need medicated much, as I always say. Medicate little and replace lots.
Okay.
So let's talk about some of that. Okay. The very first thing that we talked about was the 6-delta desaturase, which can be fixed with evening primrose oil. There are lots of sources of omega-6 fatty acids that have GLA, gamma-linolenic acid, in them, but evening primrose oil, well grown, is 12%, and that is a huge number. Most foods are down at 1 or 2.
Okay.
Where flax is. Okay. Not to be confused with fish oils, which work because of DHA and have another mechanism, and both are a good idea. I personally can't take fish oils; it gives me GERD. And I have been on evening primrose oil since the day I met David Horobin. I went, really? And I started taking it, and I don't know, I've been growing and maturing since I was 40 years old, so I don't know what it does to a 40-year-old. I'm just not taking any chances, okay? And so there's lots, and they call it EPA, okay? They call it, GLA, gamma-linolenic acid, DHA, and a lot of times they're mixed together. A good company makes a product called Efalex for children, EFALEX, that I think probably has kind of brought all those ingredients together in perfect proportions, and people can find that. And as we said, that's genetic. Okay, this is all about gene expression. Okay, so we want to remember that, we're not going to change the underlying problem. And there's lots and lots of research that has gone past talking about the essential fatty acids and what they do. We talked a little bit about the fact that the Europeans came out with a product called Liposure, Liposure, which was Enfamil, or Ensure, with evening primrose oil in it. Okay, and you can buy it in the United States as this product called Enfamil Neuro Pro, but you won't find it at Kroger's. You'll have to buy it online. They made it a law in the EU and in Europe that you had to put GLA in all infant formula.
How about, you're talking about infant formula, what about breastfed babies?
They're getting a lot of it. And breastfed is, not being breastfed is an increased risk factor for ADD.
So better to breastfeed.
Better to breastfeed, and better to breastfeed and have mom take evening primrose oil.
That's what I was going to ask you.
Right, that's the right.
Can a mom supplement? Okay.
Right. Well, we talked about the fact that eczema and atopic dermatitis is associated with the ADD. It's interesting, there's a lot of subterfuge in the research, and I found this today, that here's a study that gave flax oil, which contains almost nothing, and vitamin C, and it helped. And here's a recommendation that we use fish oil, omega-3, okay? And yet we had all that research, and some of it would come out and say, well, we studied evening primrose oil in ADD, and as a placebo, we gave vitamin C to the other half, and they both did better, so we concluded it didn't work.
Oh.
They know how to design a study so you can come up with a negative result and still actually gather the data. And so, having said that, I want to switch from here over to traditional drug therapy, which I detest.
Before we let you off the hook here on this one, you mentioned in passing several times about the genetic root underneath this. But then why are we seeing such a rampant increase in or unless you're going to come back to that in recent decades?
No, we can cover that now. It's a good point. There's going to be a number of things. One of the things is going to be all the schools are carpeted now. Okay. One of them is going to be all of the pseudoestrogens and xenodisruptors and endocrine disruptors that are in bottled water and all of our food liners, and the fact that we're interfering with our normal endocrinology.
Okay, so people should go back and take a look at your recent video on male and female hormones that we talked about.
Correct. And then we've got the issue of the EMF, and of course I hate fluorescents. They're very irritating to ADD people, okay? But over and above that, we have all this EMF from the routers and the cell phones, and that's a factor. I tell people, if you want to do an interesting experiment, you got a couple ADD kids at home, okay? When you get home on Friday night and the kids have gone to bed, go through the house and turn everything off.
Right.
Every tablet, every phone, every router, okay? Every range extender, and let the kids get up in the morning. And these people come back and go, that was amazing. I said, my kids are always fighting with each other. They got up in the morning and we're sitting playing with each other on the floor. And I went, this is pretty crazy. And I went over and hit the on buttons on all of this stuff. And within 5 minutes, they're tearing each other apart. And I go, yeah, it's called DSL. Get your cable into the walls all over your house and get the internet out of your home. Get the internet on cable and get it off of Wi-Fi.
Wi-Fi, I see, yeah.
Yeah, the Wi-Fi is absolutely tough on these kids. It's just, stimulating, just like the fluorescents
And
are.
it's more and more present everywhere you go.
Sure, right? If you go downtown in our town here, like most downtowns, all the businesses are 14, 16 feet wide and the depth of a half a city block and have an apartment or two above them. And so if you stand in the middle of our downtown and hit Wi-Fi,
Oh, yeah.
this is the first time I ever saw a scroll bar. Okay? 39 routers, okay? And range extenders. And you go, who are those people? They must be cooking inside. This is microwave, okay? That thing where you take the 6 cell phones, and point the bottoms towards each other and call them and you can pop popcorn's true. I've done it.
Huh.
It's crazy. So, we're being killed. And EMF's another issue for another day.
Another day.
Okay. So I want to talk about Ritalin, Adderall, Concerta, et cetera, all of those drugs, okay? I detest them and I try very hard not to use them. My wife, who is a counselor, and I agree on the statement that the purpose of those drugs is to keep people from being thrown out of school.
Okay.
Until then, I'm still in that school and fighting not to medicate that child. The big controversy is we may all remember a weight loss product that was invented probably about 20 years ago called Meridia. And if I remember correctly, they took the molecule Prozac and attached it to amphetamine sulfate, okay? And it really, really worked, except for everybody that got heart valve abnormalities and they had to have echocardiograms and heart valves replaced, okay? And pretty quickly, that all turned out to be true. These drugs are really hard on heart valves. Is anybody telling anybody this? Okay? The second problem that's interesting is 1 year in the middle of the studies, it was the #1 drug to be misprescribed. The pharmacist made a mistake on the basis of the doctor's orders and gave the wrong drug
dose,
or the wrong dose or the wrong form, okay? And I've seen quite a few of these. Frank psychosis. I had, 20 years ago, a 4-year-old on 80 milligrams of amphetamine sulfate, weighed 35 pounds. Had the most severe osteoporosis I've ever seen, and this kid just sat in a chair with a tremor and couldn't speak. And Mom said, we don't know what's happening to him. And I said, he's overdosed. Well, then, guess what happens? We go, okay, let's stop. Well, he went into amphetamine withdrawal. We finally had to admit him to a detox program, and the only place that could do it was Ohio State, because nobody knows how to detox a 4-year-old. And they had to put him on a Valium drip so he didn't seize and clean him up. And sadly, when we got done, my final diagnosis was he didn't even have ADD. His mom and dad were in the middle of a divorce, and he was anxious. Okay? They stunt growth for the same reason bones dissolve. Okay? I've seen some real short stature kids from getting put on amphetamines when they're 5 and 6. It's one thing to do it when you're in the 8th grade and you've got most of your linear growth behind you. But there's, you watch these kids on growth curves and they're following the 30th or 40th percentile, and then boom. And I'm a good example of that. Ritalin amphetamine sulfate was figured out, and ADD was figured out when I was a junior in high school. And my dad was a family doc, and he immediately gave it to me. My grades went straight from B's and C's to straight A's, okay? and I performed at a very, very high level, okay? And I graduated from high school 4'11", and when I got to college, I decided I didn't really want to take drugs to do college. I decided I'd adjust my study habits and stopped taking them and grew a foot my freshman year.
Oh my gosh.
Yeah. And so thank heavens I had a growth spurt after I stopped the amphetamines, or I'd be 4'11" instead of 5'10"3/4. Okay? That would have changed my life. Okay? Here's one. This was in the American Academy of Family Practice. Ritalin's okay for preschoolers. And they're talking about 30 months old. I'm sorry, why am I giving Ritalin to... This is because mom's overwhelmed by a busy child? Getting counseling. You've got to be kidding me. That's not the kid's problem. That's the mother's problem. But you're seeing that. You're watching kids that are being medicated and they aren't even in school yet. You know, you shouldn't really even be taught. I mean, you know, what are you doing in first grade? Cutting pennies out of papers and talking about Abraham Lincoln and President's Day? You know, really, are you learning anything in kindergarten and first grade that you aren't going to play catch up on in third grade? You really aren't being asked to integrate a lot of material until third or fourth grade. That's when you see ADD coming forward and really disrupting these kids' capacity to function. Before that, they're a behavior problem. Okay? The concept that these child psychiatrists are medicating these kids, I think, is an obscenity. Okay? So let's switch and let's go, okay, so you think your kid's going to need to be medicated? There it is. Guanfacine, 10x. People have seen ads on TV for Intuniv. Okay? I always tell people that I can make you autistic in 1 minute. Absolutely make you autistic. All I have to do is strap you down in that chair, tape your eyes open so you can't close them, and put two 1200-watt speakers on both sides of you and turn on Def Leppard, turn it to the top, and turn a strobe on in your face. And what are you going to do? You're going to start rocking and groaning because you're being overstimulated.
Okay.
Okay? And people look at autistic children and think those kids are stupid. Okay? They're retards. Okay? I had a severely autistic child who I put on 10x, and he went to bed as he took one dose and got up in the morning, and had been mute all of his life, and walked down the next morning and walked up to mom and said, "What are we having for breakfast?" And caught up. He was 11 and he caught up in school in 2 years. Graduated valedictorian of his class. Nothing but 10x. He was being stimulated so hard that the world was screaming at him. What 10x does is it turns down the alpha ganglionic stimulation of the midbrain, which is where all of your respiration and blood pressure and sexual appetite and are at. And so at a reptilian level, he was just absolutely massive fight or flight.
Right.
And the minute you give these kids guanfacine, it's just turning that rheostat down, dimming those lights, turning that volume down. And the nice thing is, it's a bedtime dose. And so the school's not involved. They don't even need to know that the child is medicated. And once these kids have had Ritalin, I can't get 10x to work. It's helpful, but not great. I have a study here in which they did a head-to-head crossover, but the kids didn't get to be on amphetamines long enough to be addicted. But once that you get them really entrenched in those stimulants, that guanfacine and all of these nutritional things don't work. And so the very first thing I always do to all of my children, along with looking at the metals and getting the GLA going and getting the EMF turned off, is I put them on 10x. And that's about all I ever have to do. Most of my kids come back and go, I can cope. Now mom's working hard with the teacher, kids working hard to learn to be a better student. You know, I'm asking them to bring their part to the game.
Now, you've said a couple of times about how taking amphetamines and stimulants puts you into a different realm where it's more difficult for these more subtle approaches to be effective. Is there a cooling off period where you can reclaim the Garden of Eden again? Never
seen it. No. Once these kids have seen amphetamines, it's the only drug that seems to work, sadly.
Dang.
Yeah, dang. Yeah, it's really, really frustrating. Especially if they've been on it for very long. I think you can put kids on and, do a little 2-week test and go, I'm not going to do that, it's not going to do that. But once that they get addicted, attenuated, used to it, their bones start shutting down. They seem to be hardwired by these drugs. It changes their brain chemistry.
And now is that age dependent? The hardwiring part and the changing the brain.
There
In other
is.
words, if you don't first get exposed till upper high school age, are you more protected than if it was?
I don't have
younger
enough.
age?
I don't have enough experience to answer
Right,
that. That's a great question, and I can't answer that. Here was the study I was talking about that was rolling kids for 5 days from placebo to guanfacine to amphetamine sulfate, and the kids did equally well. Go ahead and walk into a pediatrician and see whether or not they offer you that, okay? Now, if that doesn't work, this is our next drug, okay? Modafinil, okay? Modafinil is, which used to be called Provigil and is now Nuvigil, okay, as it went to a new brand name, and Modafinil, if it's generic. Again, is a controlled substance. You've got to be drug screened and go in every month and fill your script. Same problem that you have with amphetamines. And this drug, they managed to take all of the side effects of amphetamines off the drug. So you don't see loss of appetite, you don't see high blood pressure, you don't see bone breakdown, you don't see hard wiring. These kids can come and go. When I finally get to the point where I go, okay, this kid's in trouble in school, I'm going to go to modafinil. The literature says it only works in ADHD boys. My experience has been it works even better in ADHD girls. But this drug, if you can get it, almost always works. But the families are always disappointed because even though it's in the literature, it's so off-label for the insurance industry that they want the kids on Ritalin or amphetamines. They don't want them on this. You can make Ritalin for 20 cents and sell it for $200. Modafinil doesn't have the markup. And so the insurance companies that are getting that markup don't want it, okay? And I just tell people, grow up and go buy your own. Don't poison your kid.
Yeah.
And by the time I get to modafinil, almost everybody in my practice is in control. Probably less than 15% of my kids ever see that drug. And there's lots and lots of research on that. No withdrawal. There's a study that proved that there was no withdrawal. And I like this. I'm going to read this one. The Food and Drug Administration Advisory Committee said modafinil is not safe for treating ADHD in children and adolescents by a 12-1 vote. Although committee members unanimously agreed the drug was effective for that indication.
So safety was their concern.
Yeah, the safety of Ritalin sales. What could you possibly conclude that Ritalin with weight loss, stunted growth, osteoporosis, and addiction is better than a drug that nobody can find any side effects on? And what they said was, we found a kid who got Stevens-Johnson syndrome, which is where your mouth breaks out in sores and it's really a threatening disease you can die from. I go, really? I'm going to give millions of kids in the United States heart valve incrustations and addiction, osteoporosis, and short stature so that one kid doesn't get mouth sores? This is a crazy world. Absolutely crazy world. And so, I hope that kind of gives people a way to go through. First of all, they're in control. First of all, they have advocacy for their child. Okay? Don't just send your kid to school and listen to the teachers. Be suspect. Recognize they have motivations other than the welfare of your child. Okay?
And you, even more fundamental, what you mentioned first was, as an advocate for your child, work on building up your child's self-image,
absolutely,
their self-understanding, and their self-management skills.
Absolutely. And so you want to, and you can get your evening primrose oil going, and you can get rid of your aluminum deodorant, and you can clean up your food allergies and work with somebody who can do that, and you can get rid of the sugar and food dyes and the preservatives and now genetically modified foods, which I think are causing gut leak and aggravating this problem, and avoid the artificial sweeteners. And you may look up and go, And the teacher may come back and say, he looks better.
Yeah, our son, the same one we were talking about, was night and day difference when either subject to environmental triggers for his allergies or not.
Right.
The behavior just went off the charts.
My brother had an asthma attack and he'd have ADD.
Yep.
Yeah, it was awful. The minute that whatever threw him into his asthma attack also made him absolutely frantic with ADD, because it usually didn't happen to him. He wasn't like me, okay? But boy, did it come out when he got an asthma attack. And that wasn't panic or fear. He really developed all the symptoms of ADD. And then you're finally at the point where you go, okay, I'm going to have to do something. You want to be walking in there and pressing that doc to go, I want to try guanfacine, 10x, and Intuniv, okay, and see what happens. That's probably going to cover most of my kids. I might end up at Modafinil, but I would really, the only reason I was going to tell a story. I have a dear friend of mine's daughter came to me at the end of college, and she was 22 years old, and she said, I'm really having a hard time finishing. The further I go in college, the more I'm having problems with exams. And I said, well, what's happening? She says, I honestly just can't pay attention. She said, I just get bored. These are 2-hour exams, a lot of material, a lot of work, highly technical. I'm in nursing prep, work going on to do my master's degree in nursing. This is starting to be 500 level classes. And I simply can't stay on task. And I said, I want to just do an experiment. I'm just going to write the very smallest dose, 10 milligrams of Ritalin. I'm going to give you 10 tablets. And what I want you to do is just take Ritalin before your exam. And she said, okay, that makes sense to me. I said, it does sound like ADD to me. 2 years later, she shows up. She says, can I get another script for Ritalin? I went, whoa, wait a second. What happened? And she said, well, I need another script. I said, I gave you 10 tablets. She said, I only had 10 exams. Her entire life was changed with 10 microscopic doses. Microscopic, 10 milligrams, short acting, was enough for her to get through a 2-hour exam. And she wasn't even taking them for all her exams. She was taking them for
the biggies.
The biggies.
Yeah.
MCATs, etc. And I did that. I went all the way through college and never took any more Ritalin, and left my last bottle in my sock drawer and took Ritalin to take my MCATs for medical school.
Okay.
And I went 8 hours of exams. Nah, I took Ritalin for that. And I could tell. It was really an interesting experience to go, wow, this is nice. This is how other people live. My brain just slowed right down, focused. I wasn't watching the clock. I wasn't thinking about the guy who was tapping his pencil beside me. I was on my stuff.
Have you, with either your direct practice or with any of the counselors that you've worked with in integrative practice, used music such as Baroque music or any other type of music to help get the
I always ask, especially girls, I always ask a lot of questions about what does the day look like? How are they sleeping? Okay, a child who is not sleeping needs to work on getting sleep. Sleep disruption's a big deal for ADD. How are they eating? How are they resting? Where do they want to do school? If a kid wants to put headphones on and listen to Def Leppard while they study, and that works, I don't have a problem with that. That's white noise. Yeah. Okay? That's not that example I talked about me making you autistic. That kid is using white noise to shut out the world. That doesn't work for me. I needed quiet.
Yeah. I've always thought that silence was the only way that I could focus. And I was recently had an experience that really opened up my eyes about my own experience on that. When at a car dealer trying to get work done while my car was being repaired, they have a little customer area where you can go and I could get on the internet and so on and get connected to work. And they had a TV blaring some inane show, and they had the radio playing overhead. So you got the radio DJs talking to you from above, and you got the TV blaring from the side, and then the salespeople in the office squawking around. Finally, in desperation, I got out my earbuds and I looked online and found some relaxing music YouTube video and played it, and all of a sudden, I swear, I got more done in the next hour than I normally could have in 3 hours in that type of situation.
And you'd have to know what that music is, because it has to be music that doesn't engage you.
No, right, exactly.
You know,
Yeah.
you can't put on Michael Jackson or I'm going to start dancing.
Yeah, no, right.
You know, you've got to find something that is going to sit into the background. Classical music would do that to me. I know a lot of classical music. I don't listen to it, but if I wanted to make myself calm down, putting Chopin on would have that effect on me.
Okay,
Correct.
we'll have another session another time about other strategies. Now you mentioned, and I'm not sure that we covered it completely, and I promised you I'd ask you again about this. Your mom gave you certain self-talk things, or maybe you meant the self-management lists and that sort of thing that she gave you.
No, my mother worked very, very hard on self-talk. She sat down. I can't tell you how many times that my mother looked at me and said, "You're just such a great kid." You have to catch children at being good.
Yep.
Okay? You have to catch them at being successful. And if your purpose is to catch them at doing things bad, an ADD kid, and my story about the fact that all you had to do to make me feel bad was tell me I disappointed you. Mm-hmm. And my mother let me make my own decisions when I made mistakes. She could kind of tell when I was struggling with underperforming, if I'd done something. She would pull me aside. She'd say, "You seem upset. What happened?" And I said, "Well, you know how much I like Mrs. Furry, and I said something today and I made her mad, and I don't know what to do, because when I left, I knew she was mad at me." Well, what happened? And she'd walk me through it. Well, the first thing is she wanted me to see where it went south.
The early warning signs.
Yeah, well, I could have not done this if I'd have seen this.
Early off ramps.
Yeah, where are the guardrails here? Okay, and then she would say, "Well, what's the right thing to do?" Okay, I don't know if I've ever told this story on here. This story is very upsetting to me. When I was a very young physician, 1 year in practice, I made a mistake and injected a man with injectable penicillin for a strep throat, who right on his chart it said he had penicillin allergy, and he died. And I couldn't resuscitate. I was an ER doc, and he died. I couldn't resuscitate him, and I went home that night and did what anybody who's upset would do. I called my mother, okay, and I said, I don't know what to do. I think maybe I shouldn't be a doctor. This just is a message to me that maybe I'm the wrong person to do this. That I shouldn't have made a mistake like that. And so she did a lot of self-talk with me, and I said, "I don't know what to do." And she said, "If this weren't a death, what would you do?" And I said, "I'd apologize," which is what she always taught me. When you make a mistake, go apologize. And I said, "I don't have anybody to apologize to." She said, "Sure you do, the whole family." "How do I do that? They're going to be mad at me." She says, "That's not your problem. You need to go to visitation. You need to wait until visitation is closing down. You want no one to be behind you in line. And you need to go through that line, and I'm sorry for you, but you need to go apologize." I said, "Oh, I can't even imagine that." And she said, "But it's the right thing to do, isn't it?" And so I did, all by myself. And I waited and I waited and I waited, and the family saw me. And I clearly was, letting people go. And finally I went up, and one of the kids was really angry at me, etc. And I finally got up to the wife, who I unfortunately didn't know. I only knew the patient. And I explained who I was. She already knew that. And I told her I was so sorry, that it was a mistake, and there's nothing I can do about it. And I think you ought to sue me. Okay, that's why I carry malpractice insurance. She completely transformed. She said, "Oh, I would never sue you because you apologized." That made me a person who apologizes very easily now, and that is the thing that endeared me to my teachers. Once my teachers figured out that the thing that upset me the most was failing them, they worked very hard to not set me up for failure. They did everything they could to modify my environment. As my classmates, I'll see all my classmates for my 50th coming up in about another month here, or two, whenever it's coming up. And someone will probably say in humor the most commonly stated thing for 12 years of school when I grew up. Does anybody know the answer? Not you, Jay. And there are people who probably think that's my last name. I cannot tell you how many times good teachers said, don't even bother to put your hand up, Jay.
I just learned to nod so the teacher would understand.
I know.
That if you need a fallback,
I'm ready.
I'm your ringer.
I'm your ringer. And the amazing thing was when nobody knew, she would look at me and go ahead, Jay. And I would know.
Yeah. It got awkward at the high school quiz bowl when the proctor would turn to my son. They would ask the question of the two teams and turn to my son in anticipation of the answer because
it was
90% of the answers were coming from him anyway. So it's a little awkward for the other
My
parents.
son's the same way.
Yeah. So, well, we are really out of time. Dr. Nielsen, you've been most generous, not only with factual and the types of information that people truly aren't going to be hearing from most of the mainstream sources that they're looking for, but also the vulnerability and openness that you shared with about, because I'm thinking about the moms and dads that are going to be watching this and how much their hearts are breaking because they want with all their being for the success of their child. And
they can have
that so much in such greater measure with such greater abundance of life. And I've seen the transformation in my own son's life to see him come, what do you call it, late blooming or whatever you want to call it, just to believe what was not possible, what he thought was not possible for him, what others thought was not possible for him, and he's running circles around us all.
Right.
So
and I did the same thing. It's just amazing the things that I managed to use my skills running a contract research organization with 56 investigators in a field no one had ever done it in, was only possible for me because I could multitask that many things. That's an amazing concept from someone who's supposed to be distracted.
Yeah, right. Unmanageable.
Hyper performing.
Right.
Yeah, if you can get out of the way and let these kids succeed, they will outrun you and leave you in the dust.
That's another thing we're going to have to talk to. I'm going to find some educator alternative, whether it's homeschooling, whether it's special perspectives. We're going to have to get people
really
to unlock the doors of the cages to let these high-performing potential kids have avenues that they aren't being provided with, because it's really an indictment of this factory system that we've got of trying to say this is the one-size-fits-all, and if you don't fit it, you're the problem. Right. Okay, well, we've got to let it go there, but thank you, Dr. Jane Nielsen, once again for joining us on HealingYourself.Life.
This was a pleasure. I enjoyed it as much as I thought I would.
Okay, thanks.